Today we will discuss asbestosis, but really quickly, are you fed up with lectures using complex vocabulary to appear smarter? Whether you're a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Asbestosis is a lung disease caused by inhaling asbestos fibers, which can lead to scarring of the lung tissue. This usually happens after prolonged exposure to asbestos, often in workplaces like construction or shipbuilding. Symptoms. Common symptoms include shortness of breath, persistent cough, chest pain, fatigue, clubbing of fingers, widening and rounding of the tips. Diagnosis. To know if you have this condition, you should consult a doctor, see if you have symptoms and a history of asbestos exposure, see a healthcare professional. Medical history. The doctor will ask about your exposure to asbestos and any symptoms. Imaging tests. A chest x-ray or a CT scan can show lung damage. Pulmonary function tests. These tests measure how well your lungs are working. If you suspect you have asbestosis, seek medical advice immediately. If someone has asbestosis, here is what to do. See a doctor, get a proper diagnosis and treatment plan. Avoid further exposure. Stay away from the asbestos and environments where it might be present. Follow treatment. Follow the doctor's advice, which may include medications and breathing exercises. Stay active. Gentle exercise can help improve breathing. Join support groups. Connecting with others can provide emotional support and information, especially if this was a workplace incident and you know that others have suffered the same fate as yourself. Regular checkups. Keep up with doctor visits to monitor lung health. Always prioritize health and follow medical guidance. In the hospital, here's what doctors typically do for someone with this condition. Assessment. They check symptoms and medical history. Breathing support. They may provide oxygen to help with breathing. Medications. They might give medicines to reduce inflammation or relieve symptoms. Pulmonary rehabilitation. Patients may join programs that exclude exercises and education to improve lung function. Monitoring. Doctors will keep an eye on lung health and symptoms. The goal is to help manage symptoms and improve quality of life. Common medications used for managing asbestosis include bronchodilators. These help open up airway. Examples include albuterol, brand name Ventolin or ProAir. Corticosteroids. These reduce inflammation. Examples include prednisone. Oxygen therapy. Not a medication, but supplemental oxygen can help with breathing. Mucolytics. They help thin the mucus so you can cough it up and out of your body. Example is acetylcysteine, brand name Mucomyst. And these mucolytics help thin the mucus in the lungs. Always consult a doctor for personalized treatment and prescriptions. People at increased risk of developing asbestosis include workers in certain industries, those who work in construction, shipbuilding, or manufacturing where asbestos is used. Asbestos miners, individuals who mine or handle asbestos directly. Renovators or demolition workers, people who disturb old buildings that may contain asbestos. So people who demolish buildings, as in, we're gonna take down this building because it's not needed anymore. Family members, Those who live with someone exposed to asbestos may breathe in fibers brought home on clothing. So if your partner, for example, works in construction and he's exposed to this, he or she will return home and you may be at risk of being exposed to that. Smokers. Smoking combined with asbestos exposure significantly increases the risk. If you fit into any of these categories, it's important to be aware of the risk and seek regular checkups. Now you need to watch my video on heart attacks or have a look at strokes.